I'm Mary Lee Pickard, and I work for OSHIIP. I'm a community liaison. And with me today is Lisa Dauga, who works for SMP. So, Lisa, what is SMP?
Well, Mary, the Ohio SMP, we're a federally funded program, grant funded through the Administration for Community Living. And our mission is to go out and empower Medicare beneficiaries, family members, caregivers on how to prevent, detect, and report healthcare fraud, Medicare fraud.
Okay. Well, there's no Medicare fraud out there, is there?
Oh, none. Just $60 billion a year worth.
Wow.
Yeah.
Wow.
It's rampant. It's rampant.
Can you give any examples of things that you've had to deal with?
Sure. Some of the scams that are really going around now, unfortunately, they were the same as they were in 2019, but when I first started, but they've got a little bit of a twist to them now. So the big ones we see are where someone will receive a call from someone pretending to be or saying they're with Medicare or associated with Medicare, asking to confirm a Medicare number because they want to get that information and use that number. But they're saying, we're going to send you a new Medicare card. And we know, as you know at OSHIIP, Medicare is not sending out new cards. But the ploy they use is it'll be a plastic card, or it'll be a card with a chip, or it'll be a black card or a gold card, just something like that. And really what they're after is personal information. Sometimes they may already have a Medicare number, but they're looking for a date of birth, a primary care physician, something like that. So that's one that we see a lot of. Another that we see a great deal of is genetic testing. And when I started in 2019, this is one that's really taken a turn kind of each year or so, changes a little bit. So when I started in 2019, the big thing was was cancer genetic testing. Mm-hmm. So it was, what cancers are you predisposed to your family? And they would send a cheek swab. And involved in these scams, they're very integrated, vertically integrated. They're very complex. So you'd have a lab involved, you'd have a call center involved, you'd have a physician involved, and everybody's taking a piece of the action along the way. And ultimately, what they're doing is trying to get a cheek swab from a beneficiary, get their Medicare number, and then charge Medicare for those tests. Wow. And then it went from, in about December of last year, it morphed a little bit because people were catching on to the cancer genetic testing. It was cardiac genetic testing. So, are you predisposed to heart diseases? Do you have high blood pressure? Do you smoke? Do you have high cholesterol? Well, many of us are going to answer yes to something like that. And if we don't, they're going to say, well, what about your family history? Because it's a genetic test. So we're looking at family history. Again, what they're really after is your personal information to charge Medicare for that service. And then the most recent one I've seen in the genetic testing is immunological diseases. So again, They catch on to one, they just twist a little bit and move on.
Wow. Well, if someone wants to talk to you or someone at SMP, Senior Medicare Patrol, how can they reach you?
They can reach us by phone. You can call us at 1-800-488-6070, or you can call Mary Helen Direct, who does our intake, at 513-458-5523, and she will answer the phone directly. The 800 number, just ask for Mary Helen, and they'll connect you with her. So you would call, and Mary Helen will ask, about the call. What did they say to you? What did you say to them? What information was provided? What information did they have? Because quite often they already have a Medicare number. They're looking for maybe a date of birth or primary care physician, like I said earlier, and that they're trying to put your personal puzzle together just piece by piece.
Okay.
And even if they don't use it, they will sell it. And even if they do use it, they're still going to sell it. So it's all about getting your information for their financial gain. So then Mary Helen would, or myself or Jenny, whoever takes the calls, it's generally Mary Helen, but if she's not there or she's tied up with another case, we will again ask you what information, who did you talk to, what did you give, to guide us in how to guide you. Do we need to talk to Medicare? Do you have a supplemental plan we need to let know? Did you give out your Social Security number? We'll refer you to Social Security, things like that. If it's a switched in plans, we'll refer them to you at OSHIIP, send it your way. So we will just, if it's not us, we will refer them to somebody. We partner with so many people like yourselves.
Wow. Great service, by the way.
Thanks.
Thank you for coming by today to see us, and look forward to working with you again, because we're such great partners. So glad you came over.
Well, thank you. I really appreciate you having us. And again, we love partnering with you as well. So thank you very much.
Yeah.
Bye. See ya.
For more information, contact OSHIIP at 1-800-686-1578 or visit us at insurance.ohio.gov. That's it for this week's episode. Thanks for tuning in. We'll see you next time.